Okay, perfect. Can everybody see the slides that are up? Okay, awesome. So yeah, we'll just get started, and if other people jump on, that's cool too. So my name is Dr. Ruth Solomon. I'm a board certified family physician. I am the co-founder and CMO of AprilMD. We're located in Babylon, New York, and today I'm going to be doing a quick talk on the health of women who lead, steps to a healthier life. So a lot of the things in this presentation are like a general overview. So it's going to be like a lot of information. But just, keep in mind as we're going through sort of like how these different things can relate for yourself. Also, please excuse my voice. For some reason, all the landscapers in my neighborhood decided to cut grass at the same time, and I'm allergic to grass. So that's why I sound like this. So let's just take a moment right now, grab a drink of water, grab a cup of tea, let's stretch, unplug, and really create space for ourselves. I know a lot of you are super busy, and the time that you took today tells me that your health is important to you and that you're willing to take this moment. So, let's just create that space mentally speaking. Also, the medical disclaimer. So this presentation is for educational purposes only. Please consult your physician if you have any personal health concerns, okay? So before we get started jumping in, 1 in 4 female entrepreneurs are projected to grow their workforce by about 6+ employees. And that was according to an article that was done in the World Economic Forum that was published back in 2024. Why is this important? Because it shows us that female entrepreneurs are actually driving major local job growth. I did my residency in Pittsburgh, Pennsylvania, and unfortunately, something that happened there is big steel collapsed and the local economy suffered. So we see that female entrepreneurs, those who are starting their own businesses, those who are becoming more active in the economic world, are actually allowing their local communities to thrive, which is important. In the same article, it also addressed that female entrepreneurs actually tend to enter self-employment younger than their male counterparts. So the average age is like late 30s to early 40s as compared to men, which is like their 40s to 50s. And also they're building with a lot less support. Women are less likely to get access to loans, less likely to get access to capital funding, less likely to get access to grants. So making a lot happen with a lot less. And I think a lot of women can definitely identify with that. So, what does this then translate to when we're talking about your overall health? So, unfortunately, high performance can also sometimes come at the expense of your health. So, there was a study or an article that was published in Psychology Today, and it talked about mental health issues, especially for women who are employed and sort of working at like the high levels of their field. We see higher rates of burnout, higher rates of mental health challenges. We also see, unfortunately, women are more prone to having insomnia or sleep problems when compared to their mental counterparts. There was also this Lancet study that was done. The study was published in 2024, but it was looking at data from 2021 and basically just comparing female to male outcomes when you look at morbidity and mortality. And overall, the data was showing that although women do live longer than men, we tend to have more chronic health conditions, more chronic health issues overall when compared to our male counterparts. And this one actually made me a little sad, I'm not going to lie. There was a Danish study that was published back in 2019, and it showed that women receive the diagnosis for the same condition as men. And in the cohort that they were looking at, when they corrected for the disease timing. So, they weren't going to compare somebody who was, diagnosed with stage 1 cancer and stage 4 cancer. So when they actually went through and adjusted for that, women received a diagnosis 2 to 4 years later than men for the exact same condition. And a lot of that was attributed to women were seeking care later. And a lot of the times, unfortunately, everything falls on us. We put ourselves at the bottom of the list and we get to it when we get to it. So why does this matter? In America, unfortunately, 25% of working Americans will experience some kind of disability before they hit retirement age. 60% of bankruptcies in America are tied to medical expenses. And sadly, women are more likely to be the ones to have to step away from the workforce for caregiving or for health-related concerns. I always like to put an asterisk on caregiving because I think a lot of the times when we think of caregiving, we automatically assume children. And that's not always the case. Caregiving is just when you are in charge of someone else's care. So that could be elderly parents, that could be grandparents, that could be your in-laws, that could be your siblings. I can say from personal experience, my mother-in-law never calls my husband or his brother. She always calls me or my sister-in-law when she needs something. And so again, women, we get positioned in these areas of life where we have to take on so much for everyone else. We end up putting ourselves last. So the things that, I want us to kind of like talk about and then sort of start with the symptoms and then where can these symptoms be leading us to potentially? So the big one, fatigue. And I think it's important to have a definition that we're working off of. So it's not just like the feeling of being tired, but it's being tired or exhausted in spite of the fact that you're getting, your 7 to 9 hours of sleep. You're dealing with your stress management, you're doing your self-care, you're eating properly, you're doing the things that you're supposed to be doing, and you're still super, super tired and exhausted. Brain fog, defining it as sort of like this lack of focus, forgetfulness, trouble with concentrating, unintended weight changes. Um, Now, usually day to day, people will fluctuate in their weight, like 2, 3 pounds. That's normal. But if you're telling me that you lost 20 pounds in a month and you weren't trying to do so, that's very concerning and something that needs to be talked about. And then, of course, mood, anxiety, depression, irritability, and then low motivation. And with these symptoms, they're affecting your ability to function in life. And I know a lot of the times, and I do this myself. It's like you push through, you push through, you push through until you can't anymore. And when we're getting to the point where we can't anymore, gotta step back and kind of look at what is going on. And, is there something else here other than I'm just overexerting myself? Is there an actual medical condition that's underlying it? Now, this is not meant to scare anybody. It's just things that, again, I want you to be aware of. These are like the red flag symptoms that, you should be either talking to a doctor or going to an emergency department. So, if you're losing consciousness, you should be going to an ED. Let's figure out why that is. If you're having trouble speaking, if you're having focal weakness just means that you can't move a specific part of your body. Not the feeling of being, oh, I feel weak. It's like I can't move my hand. That's an emergency, go to the hospital. If you're having severe chest pain or upper stomach pain, so your chest being this area here, when I'm talking about the upper stomach, I'm actually talking about the area right here, sort of where your breasts kind of meet the top of your stomach area in that area. If you're getting pain that's so bad that you can't think through it, you can't speak through it, it's really serious, you need to go to the emergency department for that. If you're having palpitations, this feeling that your heart is racing, vision changes, you're having loss of part of your visual field, or maybe you're seeing sparkling lights, or you feel like a curtain is coming down. Persistent headaches, so headaches that are not getting better after you've hydrated, you've taken adequate pain medication, or if you're having like your hair is falling out, or you're having very specific skin changes, definitely go to see your doctor in those situations. So again, not meant to scare anybody, just to make you aware that like, these are the things that we should be looking out for. So with health challenges, there's sort of like five big areas that I just wanted to touch on really quickly. And unfortunately, these are areas that we see our women are more likely to have issues as compared to our male counterparts. So nutritional deficiencies, lack of essential nutrients, hormonal disruptions, which can affect both your metabolism and your physical functioning, metabolic illness, which is unfortunately something that we see a lot in the United States, inadequate sleep, insufficient rest, and there's a lot of different reasons why that can take place. And then also autoimmune illnesses. So basically, your body's immune system is attacking itself, which again, we see this more so in women than in men. So with the common nutritional deficiencies, the four that we see a lot in women, iron deficiency anemia, because of our menstrual cycles, If you're not replenishing your iron after you've had that blood loss, it can lead, it's actually the most common nutritional deficiency that affects women as compared to only like 2 to 3% of men. The thing with a lot of these nutritional deficiencies is that when we can, we want to try to strive to get these things from our whole food sources. Supplements are not a bad thing, and sometimes supplementation is necessary. But looking at like specific diet changes can definitely help to either offset or mitigate these issues. So, for example, for iron deficiency anemia, eating red meat and seafood, also plant-based sources like beans, lentils, grains, spinach, cooking with a cast iron skillet. Those are all different strategies that we can utilize. Vitamin B12 deficiency, very common in vegetarians and vegans because again, you're not getting the meat intake. So here we can definitely talk about using like supplements as a way of being able to get there. So that way your vitamin B12 is not too low. Vitamin D and calcium, I like to think of them as cousins that hold hands. They go together a lot of the time. So, vitamin D deficiency, about 40% of the US population is unfortunately vitamin D deficient. Why? Because we're always indoors, and this fluorescent lighting, like what I'm sitting under, doesn't help to stimulate the cascade that our body goes through for vitamin D production. Um, Sources in food, we can look at mushroom, canned tuna, shrimp, and salmon. Also, indirect sun exposure for about 20 to 30 minutes a day. So, what do I mean by indirect sun exposure? You're not just standing out in the sun because we don't want to risk sunburns. That's not good. But if you were by an open window and you had sun coming through and you had that indirect exposure, that can definitely help. And then calcium, like I said before, vitamin D, calcium, they go hand in hand. Absorption actually decreases with age, and it is so important for our bone health. So especially for us ladies, as we go through perimenopause, menopause, those estrogen levels drop. The calcium becomes even more important in making sure that we're preventing osteoporosis. So you eating dairy, dark green vegetables like kale and broccoli, those things can all help. And again, supplements are not bad. You can take supplements to help offset, but also important to make sure that we're getting these things from the foods that we eat. Hormonal disruptions. So this is a very big topic. So I'm just going to try to break it down into sort of like the three most common things seeing in practice. So the first thing, thyroid issues. The other thing too is a lot of these different topics will overlap with each other because you can't segment your body. Everything is connected. So the same thing here. So something that we do see, thyroid issues, either you're producing too much thyroid hormone or you're not producing enough. One of the most common causes are autoimmune causes, which we'll talk about a little bit later. But unfortunately, when you're looking at both of them together, women are about 6 times more likely to have thyroid issues, both hyper and hypo, as compared to men. The good news is that these things can be treated with medication and also procedures if necessary. So if they're caught early, they can be taken care of. So perimenopause and menopause. So, menopause, I think, is something that we all kind of have a pretty good handling in medicine. Perimenopause is something that I think we're still trying to do the research for and get a better understanding of. So menopause is like, the body's natural decline of estrogen and progesterone. The thing that we think about a lot of times is like, the hot flashes, the night sweats, you're not getting your period anymore. You're leaving your reproductive years. Perimenopause is tough because, looking at the data that's coming out, it can actually start as early as like your late 30s, early 40s. And if we do blood work, everything's going to come back normal because you're not going through menopause, but you're definitely starting to feel the symptoms of what's happening. And so, what I'd like to talk to patients about is that with perimenopause, it's really blood work is more like a picture, whereas what we kind of need is a video. And taking a video in terms of your blood work doesn't really exist yet. The closest thing I can sort of relate it to is like when you have like continuous glucose monitoring, but that's not available for everything. So, a lot of women will say this. It's like, I went to my doctor, we did the blood work, everything came back normal. And it's like, well, it is going to come back normal because you're not in menopause. What we want to see is what are the fluctuations that are taking place over time as your overall levels are decreasing. Now, for treatment, a lot of it is geared towards what are your symptoms. So if you're having more, night sweats and hot flashes, then there's different medications that you can try versus if you're having, dysfunction and pain with sexual penetrative sexual intercourse. One of the things we do recommend is hormone replacement therapy, which unfortunately got a bad rap. There was this really big study that happened back in 2002, and the study really looked at women who were like in their 60s and over. So they were very far displaced from menopause. And in that group, there were a lot of really bad things that were taking place, increased cancer risk, stroke risk, blood clots. Now that we're getting more data looking at women that are actually in the perimenopause and closer to menopause under the age of 60, those risks are actually super low. And also, how you get your hormone replacement therapy is important. Taking a pill has more risks per se than if you were to have like a patch or if you were to use like a topical cream. So, there are a lot of different ways of being able to treat it. The big thing is being able to sit down, having a conversation with your doctor about what are your symptoms, and then really targeting and getting that treatment to be as specific as possible. And then PCOS, very, very common. About 1 in 10 women have PCOS. Basically, polycystic ovarian syndrome. What happens is that when you're ovulating, you have your ovary, you kind of make this cyst, it breaks off, you have the follicle. That's what's going to travel through your reproductive tract. And if you're trying to get pregnant, then that's where, fertilization takes place inside of the uterus. What happens with polycystic ovarian syndrome is that you're making all those follicles, those cysts, but they're not breaking off. And then we get an imbalance of testosterone and estrogen, and then we get all these extra symptoms. So what ends up happening is that you have like abdominal fat, insulin resistance, and then of course like the infertility concerns. So again, with this, it's targeted treatment based on what are your symptoms. So if you're having, for example, male pattern hair growth, there are medications that can be given for that. For the abdominal fat, partnering with a dietitian who understands or a nutritionist who understands PCOS and getting on a good health and wellness regimen. That's also very important. And again, targeting that treatment regimen for you specifically on how you're dealing with the symptoms that are coming up. And then we go into metabolic syndrome because metabolic syndrome and PCOS go together so much. So basically, we'll see this elevated blood sugar, elevated blood pressure, elevated cholesterol, and excess abdominal weight. And we kind of define that as looking at your waist circumference, 40 inches, more than 40 inches for men and more than 35 inches for women. That's how we define it. And then that can lead to type 2 diabetes, heart disease, stroke. And these are diseases that can be very, very, very silent. They build up slowly over time. And it's not uncommon that when people are in the hospital, that's the first time that they're hearing, oh, I didn't know I had diabetes because their blood sugar got so high, because your body will compensate for a very long time until it can't. And so, again, this is addressed with both lifestyle interventions and also with medications. And we're looking at, if you are someone who has, like, for example, type 2 diabetes, we have to get your blood sugar under control. If you're someone that does have elevated blood pressure, we have to get that under control. And the food that you eat is so, so, so important. And so, again, partnering with a registered dietitian or nutritionist who understands these illnesses and also getting you on a good health and wellness regimen with, like, exercise, activity, movement. And then the medications work to augment that. And I've had patients, they've done the work, they work really hard, and we're able to get them off of their medications once they're able to get themselves on a good meal regimen, a good meal plan, having a stabilized weight, and being able to like mitigate all those risk factors. Inadequate sleep. So, this is definitely something that a lot of us suffer from, myself included. These devices are so wonderful, but they're also so terrible. So, when it comes to insomnia, women are more likely to experience it than men. And insomnia, poor sleep is linked to pretty much everything. It all comes back to sleep. Mood disorders, stress, hormonal fluctuations, increased cortisol. There are so many things that come back to sleep. So one of the big things we always talk about is improving sleep hygiene. So, three big things that you can do. having a set wake up time every day, even on the weekends, is very important because it helps to set your body's 24-hour clock. So waking up at the same time every single day, making sure that your bed is only for sleep and sex, nothing else. So you're not scrolling on your phone, you're not doing your taxes, nothing else. What we're doing is we're teaching our bodies that when it comes to bedtime, this is the most important thing so we can wind down. And then also having a room that's cool. The recommendation is like 12 to 15 degrees Celsius, basically cool enough that you need a blanket, and having blackout curtains or making sure that the room is dark as possible. And those things a lot of the time can help with regulating your sleep cycle. The big thing though is this and any other screen. Put them away, put them outside of your room. Nobody should be scrolling before bed. And I know it's so hard and I'm guilty of it too. But that light from the phone, it really does disrupt the sleep architecture, or not sleep architecture, but the brain's ability to kind of shut down. So we want to make sure that we're creating a safe space for our sleep. Obstructive sleep apnea is super interesting. It's actually super underdiagnosed in women, and that's because a lot of the traditional symptoms that we think of, we will see, but not as much as in men as in women. So a lot of the times we talk about snoring, choking in your sleep. Unfortunately, the disease of obesity does play a role. But for a lot of women, you'll also have these, atypical symptoms, which I hate that term because why is something atypical? It affects half the population. But anyways, having headaches first thing in the morning when you wake up, having a depressed mood, feeling like your heart is racing, having severe fatigue, like we were talking about earlier, and cognitive dysfunction, that brain fog. That's a lot of the times what we see, and it's not always related to obesity. So one of the things that we can see is that if you look at your jaw and like the length of your jaw, the angle of your jaw, and also its positioning relative to your airway. If you're someone who has a face that goes in a little bit more, and the angle is maybe a little bit less steep, what will happen is that as you're sleeping, you're going to actually have more constriction of your airway. So you're going to have more mechanical problems that are going on. So again, this is the reason why in women sometimes it's not diagnosed because we're thinking like they don't fit this typical picture, but in actuality, it is a problem. Another population that we do see a lot of obstructive sleep apnea that is underdiagnosed, as in people who are East Asian, because again, looking at the length of the jaw, the angle of the jaw, and the angle towards the airway, it can be a lot more narrow. So then if you're going to sleep, you've already started to, what was already a small space has become even smaller. So again, things to look out for. All right, so autoimmune illnesses. Overall, when you're looking at all autoimmune illnesses, women are actually 4 times more likely to develop an autoimmune disorder when compared to men. Now, the theory behind that is the presence of two X chromosomes causes immune hyper or over activity. And the theory behind why that is because when evolutionarily speaking, you have females within a population, they have to be the ones who are the progenitors. You really only need one man for so many women, and we only can have like one baby at a time. So having an immune system that's very robust to have a successful pregnancy is important for a species. And unfortunately, with autoimmune illnesses, we've just taken that adaptation and it's kind of run away from us. So the three that, again, we kind of see that are pretty common. Lupus is a chronic inflammatory disease and it will affect multiple tissues and multiple organs. And there's lots of different symptoms and lots of different severity. But if you remember earlier on in the talk, I was talking about skin changes. One of the things that we see a lot in lupus is there's this butterfly rash on the face. And then with the hair loss, you can have hair loss in sort of like this temple distribution, as opposed to like when we see androgen hair loss or female hair loss, it's at the top. So when you're seeing those types of things, and then also, chronic fatigue, joint pain, those could be signs that like, potentially there might be lupus or like another autoimmune component. Thyroiditis, as we were talking about earlier, with the thyroid either doing too much or doing too little. You can see Hashimoto's, which causes hypothyroidism, low thyroid hormone production, Graves' disease, which causes high thyroid hormone production. But in both of those cases, treatment is very much readily available. Unfortunately, there's no cure, but giving for low thyroid hormone production, giving the synthetic version of the hormone very easily, readily available. And then if you have Graves' disease, there are some medications that you can give to kind of get you to when you need to have a procedure done. And then after that, we just give you the thyroid hormone to replace it. Rheumatoid arthritis. So a lot of the times when we talk about arthritis, people think of osteoarthritis, like the pain, the aches, and the joints that kind of comes from mechanical wear and tear. Or post-traumatic arthritis, like, I fell or I was in a car accident and now I have like, this chronic inflammation of my joints. Rheumatoid arthritis, if anyone remembers like your grandmothers and they had really gnarled hands or they had really bad contractures and the joints just kind of like folded in on themselves. That is what we used to see with rheumatoid arthritis before treatment options became available. So with a really good exercise regimen, a lot of people have rheumatoid arthritis. Swimming is an excellent exercise for that, but getting on a really good exercise regimen and then also being able to get, the medications, they're called DMARDs, but basically they help to control the inflammation and control the remodeling that takes place of those joints so you don't get the gnarliness. You can actually have really good independent functioning, up until your elder age, and you're still able to be independent, take care of yourself. You're not dependent on other people. So your health and your success go together. These sort of vague symptoms that we talked about in the beginning, as you can see, they can have multiple different causes. And being able to kind of take a step back and determine, like, is this just stress or is this a serious medical problem, will definitely lead to long-term success that is going to translate to every other part of your life. So the great thing is that a lot of these diseases are treatable, as we talked about. We have modern medicine, we have protocols in place and things that, for example, rheumatoid arthritis used to be even 20, 30 years ago was you were going to have an uphill battle into your old age. Now people can live functionally and independently, which is wonderful. As we talked about earlier, sometimes lifestyle is enough. Sometimes improving your sleep hygiene, getting changes in your diet, having exercise, health, wellness regimen. Sometimes those can be enough. And something as simple as just adding a supplement can help to get you where you need to be. And the impact on your everyday life can be very minimal when you have the right supports in place and when you have the right treatment protocols in place. And the great thing about this is that, again, you're treating the problems, you're getting things taken care of, but then you're able to go back to living your life. Because at the end of the day, we all are busy, we all have things to do, we all have goals that we want to achieve. We only have so many, time on this earth, and we all have the things that we want to do. So let's get back to what's important and make sure that we can do the things that are important by making sure that we take care of ourselves first. And earlier is always better. And that is a rule of thumb across medicine in general. The earlier you can get in to treat anything, the better the outcomes are going to be because you're going to have less downtime, less hospital time, less side effects. Everything just gets better when you can fix things earlier and fix it before it becomes a big problem. My lovely grandmother, God rest her soul, used to say, an ounce of prevention is worth a pound of cure. And she was 1,000% right. So, everyone here are the types of people who get things done. Like that is what we do. We're the type of people who there's a problem, we're getting it taken care of. So, what are the next steps? What is the action plan that we're going to take away from this talk today? So, the first thing I would say is log your symptoms and your patterns. A notebook or a calendar, but just some way of being able to step back in your everyday and say, how did I feel? When did I feel it? And then what was the intensity of what I'm feeling? And sometimes you can see, like, man, the morning is really tough and I get a headache every morning. Maybe it's obstructive sleep apnea. I notice that towards the end of the day, I just feel so drawn out and so terrible, maybe a nutritional deficiency. And then being able to come up with a pattern over time definitely helps to be able to pinpoint and identify, okay, what's really going on here. Even if you still have a menstrual cycle, like I'll speak for myself personally, when I enter my luteal phase, I call it my luteal brain. For a day, I'm just off and I'm not myself. So I know now that when I track my cycle on a calendar, when it's getting around luteal time, I'm not scheduling anything that requires me to have too much cognitive power. Like that's when I'm taking things a little bit easier and I'm going to be a little bit kinder to myself because I just know that like that's what I am. And being able to plan around that is really important for my life. Improve whatever it is that you can at home. So again, better sleep. Again, we talked about the sleep hygiene things, nutritious whole foods, having a plant-based diet or plant-forward diet, variety of colors, high fiber, super important. And then, of course, our mental and emotional health, also very important. So being able to change those things at home can also have a big impact on the things that some of the things that we talked about earlier. Making sure that you have a physician that you partner with in your healthcare is very important, especially as you're getting older. So don't skip the annual exam. Don't skip the blood work. Cancer screening, very, very important. Because again, the earlier we catch things, the quicker we can fix it, the quicker you can get on with the rest of your life and do the things that it is that you need to do. And then following up and setting realistic goals. So, there's this saying that Rome was not built in a day. The same thing applies to a lot of different things in life. When you're making big life changes, when you're making, more positive, choices for yourself. It's a marathon, it's not a race. And I always tell people give yourself like a year to be able to come up with a new way of living because it's going to start small and then it's going to build onto itself. So being able to get you feeling better, getting you active, those things have to be done slowly and incrementally over time. Make sure that you're going to your follow-up appointments. If you've been sent for blood work, or for imaging studies, making sure that you go, you follow up with those things. And again, really partnering with your physician and your healthcare team to make sure that we're keeping you on track. And again, realistic goals. You're not going to fix everything overnight. You're not going to fix everything in a week or a month. Again, these things can take months to years, and that's okay. And I think when you set realistic timelines in your head, then you know what you're working towards incrementally because we want sustainable success. We don't want success and then a crash afterwards, if that makes sense. So remembering your foundation is what matters, and your foundation is your health. Define success on your own terms, achieve it by your own rules, and build a life that you're proud to live. And that's a quote from Anne Sweeney. She was the former president of ABC Disney Television Group. So, a woman who was used to commanding a room. Your health is the foundation that everything else is built on. If you are not okay, the domino effect in your life, I'm sure is huge. So you have to take care of yourself first before you can do anything else. And if your body is telling you something, listen, because it is those signs and symptoms that unfortunately could be something else. And again, if we fix things early, they're not bigger problems later. Here are some of the references that I talked about. So, this we love evidence-based medicine always. And I really want to thank everyone for taking the time to come out today for us to be able to chat. And here's to healthier, stronger leadership. Okay. Um, and then if anybody is interested, through Doctoloop, you can schedule a free meet and greet. We can just have like a 15-minute chit chat or like an actual consultation. So yeah, I think I saw some questions in the chat. Let me go here. There we go. Oh, okay. Bye, Kelsey. Yes, the meeting is being recorded, and it will be available afterwards again. I just saw that from Lillian. But yeah, if anybody has any questions, feel free to drop them in the chat. How should how should I talk to my doctor about what I'm feeling? Great question. So what we touched on a little bit before, in having a more specific set of information. So doctors, we're all driven off of data. That's how we do things. So being able to have like that log, like we were talking about earlier, what am I feeling? when am I feeling it? How severely am I feeling it? And then being able to track that over time definitely helps. I also recommend to patients making sure that kind of sit down and make a list of what's important to you from what's the most important thing to the least important thing. So, if you're having chest pain, that goes first on the list versus, if you have like a hangnail or something. And being able to have that helps to organize you so that way when you get to your doctor's appointment, it's as efficient as possible. The thing I do like to note is that with traditional insurance, your doctor only has about 5 to 7 minutes. Um, so be prepared to have multiple appointments. My clinic, AprilMD, we're a direct primary care clinic, so we don't take insurance. We have a subscription model, and with that, I have half an hour appointment so I can sit down and talk to people. But if you're someone who's in the traditional insurance system, you're probably going to have more than one appointment. But at least if you're organized and you have data, you can make sure that each of those appointments are as efficient as possible. What can I do to make sure my nutritional levels are where they need to be? Another great question. So one of the things that we always recommend, and like I had said before, making sure that you have a diet that is high in whole foods. So what do I mean by that? Whole foods, basically like what you're getting from the grocery store and cooking, not necessarily what you would be getting from like a package or something that was pre-made, and making sure that you have like a variety of food. So studies that have been done show that having a plant-based diet, so the infographic that's always popular is the circle for the plate, and then half your plate is fruit and vegetables. One quarter is some kind of grain, and then the other quarter is some kind of protein. So making sure that you have lots of vegetables in your diet, also fruit, a variety of different colors, also a diet that's high in fiber. Very, very important for your overall health. And then the other side of that, in terms of the medical side, doing blood work. So checking to make sure that, your vitamin levels are where they need to be, iron, B12, those sorts of things. I, for myself, personally, I talked about this on socials. I suffer from iron deficiency anemia. I have for a long time. Stopped taking my supplements because I got super busy with my kids, and then my hair started falling out. So when I went to finally go do blood work, it was like, this is a bad thing. So, making sure that you're staying on top of having like, those nutritious meals if you're someone who has a history of being on your supplements, but also, yeah, getting your blood work done so you know exactly where everything is. Great question. So the last question, if I can push through the fatigue, is it really something I need to look into? Um, your body will compensate until it can no longer compensate. And when you get to the point where you can no longer compensate, now we have really big problems on our hands. So I would say um, the answer to that would be no. You definitely should go and get yourself checked out. Because again, for me, and again, I did this to myself. I kept pushing through symptoms until my hair was falling out. Now I have to go on like a year-long journey to get my iron back up where it needs to be. And it never needed to get to that point because earlier I was tired and I was fatigued and I was getting dizzy when I stood up. And I should have been listening to my body then to not let things get to where they got to. Take that and put it to any health condition. So even though you can push through, you still need to be able to go back and like assess because you shouldn't have to push through. You shouldn't have to. You should be able to be functional on your terms. And again, the later you get diagnosed, the bigger the problem. So let's just fix them now while they're still small. Yeah, any other questions or comments or Oh, well, again, I want to thank all of you for coming out. I really appreciate it. Yeah, and then if you're interested, the links are in the chat. Again, if you want to schedule just like a quick 15-minute meet and greet and get to know each other. Also, if you wanted a more in-depth consultation, that's also on the Dr. Loop site. And again, thank you so much, Dr. Loop, for hosting everything. This is amazing and such a great experience. So yeah, thanks everybody.
Thank you. Have a good day.
All right, take care, everyone. Bye.